Thank you, Mr. President. Mr. President, I'm on the floor today to talk about the status of America's health care system. As we speak, though, the country is obsessed with the question of the firing of FBI Director Comey and the appointment last night of a special counsel who is going to seek to get to the bottom of this question as to whether there was coordination between the Trump campaign and the Russian government in their attempts to influence an American election. There have been secret meetings happening here in the Senate amongst Republicans, reportedly 13 Republicans, to be specific, attempting to craft a new version of legislation that passed the House of Representatives now, I guess, 2 weeks ago, that would rob health care from 24 million Americans, according to the Congressional Budget Office, drive costs up for everyone immediately by about 15 to 20%, and jeopardize the protections that are built into the law for people with pre-existing conditions. There's no CBO score on the latest House proposal because Republicans decided to ram the bill through without the ability of anyone to read the legislation. No one read that bill, let's be honest. It was filed hours before it was voted on, and no one knows the cost of that bill because they didn't wait for a CBO score. It's simply unbelievable that the House of Representatives decided to reorder 1/5 of the American economy without reading the proposal or without understanding its cost. But Republicans in the Senate are attempting to pass their own version of a repeal and replace bill, and we await the result of these secret partisan meetings. I think Democrats have been pretty clear that we would like to be in this conversation. We want to preserve what works in the Affordable Care Act, and there's a lot that works. The new report out just a couple weeks ago that show an astonishing decrease in the number of people who face personal bankruptcy in this country. Why? Because half of personal bankruptcies in the United States of America prior to the Affordable Care Act being passed were due to medical debt. And so the reason that less people than ever before are having to declare personal bankruptcy is because medical bills don't bankrupt them anymore because of the Affordable Care Act. Let me guarantee you that that number will spike back up if anything approximating the House bill passes. We think there are good things in the Affordable Care Act, and our constituents agree. Polling now routinely tells you the majority of Americans want to keep the Affordable Care Act, not replace it. But we want to be part of a conversation in which we talk about keeping the things that work and addressing the parts of the healthcare system that don't work. Costs are still way too high. We would like more competition on these exchanges. And so let's have a conversation about that. But as of today, Democrats are being shut out of the process. If you're represented by Democrats in the United States Senate, you have no voice in this process because Republicans have chosen to do it just amongst their own party. I think that's a shame. I understand that in the end, Democrats passed a product in 2010 with Democratic votes, but anybody that was here remembers that there was a long process by which President Obama and Democrats in Congress tried to work with Republicans and brought the bill through the committee process. The Help Committee and the Finance Committee had exhaustive meetings, hearings, and markups. In the end, in the Help Committee, upon which I sit today, there were over 100 Republican amendments that were accepted and included in the piece of legislation that eventually passed on the floor of the Senate. As far as we know, this secret process happening behind closed doors will include no Democrats now and will not go through a committee process. If they ever come up with something that can get 50 votes, it will be rushed to the Senate floor. That's outrageous. So we want to be part of this process. But I'm on the floor today not to talk about what will happen if a bill robbing health care from millions of Americans, jeopardizing protections for people with pre-existing conditions, comes to the floor of the Senate. I want to talk about what's happening right now. Because President Trump made it very clear, just a few days after he was sworn in, that his desire was to kill the aspects of the American healthcare system that are affected by the Affordable Care Act. And by the way, that's almost the entirety of the American healthcare system, because that bill did, in addition to extending coverage to 20 million Americans, grant protections from insurance abuse to hundreds of millions more. A January 20th executive order issued by the president said that it was the policy of the administration to seek the prompt repeal of the law. And it said, to the maximum extent permitted by law, the Secretary of HHS shall exercise all authority available to them to waive, defer, grant exemptions from, delay the implementation of any provision or requirement in the Affordable Care Act that would impose a burden on any state, or a cost, or a fee, or a tax, or a penalty, or a regulatory burden on individuals, families, or health care providers. So President Trump made it clear that his motive from the start was to destroy the Affordable Care Act. And my colleagues, he has consistently kept up that attack. I'm often bringing President Trump tweets to the floor because, well, they continue to exist on social media. It's nice to be reminded of the fact that over the course of the first 100 days in office, President Trump has been routinely attacking the American healthcare system, saying Obamacare will fall of its own weight. Be careful, i.e., if you're thinking of signing up, be careful, discouraging people from signing up for these exchanges. Once again, Obamacare, it is dead, says the President of the United States, despite the fact that 19 million people rely on the exchanges for their health care coverage. Here's another one. Obamacare will explode. Do not worry, he's got it taken care of, he says. And finally, Obamacare is in a death spiral. So these are the routine, almost daily attacks, rhetorically, that this administration has waged against the Affordable Care Act. He has commanded his agencies to pick it apart in any way that they can. And so to the extent that there is any diminution in the health of these exchanges, to the extent that insurers are thinking about not participating or are pushing up their rates, there is only one reason for it. It is the active sabotage campaign that the Trump administration is engaged in to try to destroy the Affordable Care Act. This is purposeful. This is intentional. This is planned. That executive order, unlike some other executive orders, wasn't just an exercise in political and public relations, because the next month, in February, the IRS announced that it would not reject tax forms from people who failed to answer the question of whether they had health insurance. So the IRS took a definitive step to undermine the Affordable Care Act by telling consumers that they were not going to enforce the individual mandate. Now, newsflash, Republicans think the individual mandate is a good idea. After attacking it for the last 6 years, the House bill that they passed includes an individual mandate. It does. It's in a slightly different place. Instead of the penalty applying when you lose health care, in the House, all they did was just shift the penalty to when you sign up for health care again. All they did was move the mandate from when you lose health care to when you repurchase health care, but it's still there. The administration is seeking to undermine the existing mandate. And insurance companies have noticed. Senator McConnell came to the floor a week or so ago to take note of the pretty serious premium increases that were requested in Maryland, in part by Blue Cross Blue Shield. But the head of Blue Cross Blue Shield in Maryland was very clear about why they were increasing rates. He said that the uncertainty around the individual mandate plays a significant role in the company's rate filing, because failure to enforce the mandate makes it far more likely that healthier, younger individuals will drop coverage and drive up the cost for everyone else. Insurance companies are noticing that the administration is picking apart the protections that can keep rates down in the exchanges, and thus they are filing higher rates. But with less people in the exchanges than anticipated, insurance companies are also rethinking participation. And this is intentional as well. Shortly after taking office, HHS pulled the advertising for the Affordable Care Act in the last week of open enrollment. And we know exactly what happened here, because we have the data on who was signing up before Trump took office and after Trump took office. Before Trump took office, open enrollment was exceeding 2,000 open enrollment for the prior year. After that decision was made to pull funding for advertising, open enrollment cratered. The former marketing chief for healthcare.gov estimates that 480,000 people didn't sign up for coverage in the last week because the ads were pulled and because the President of the United States was out there actively telling people that you should, quote, be careful before signing up for the exchanges because he was going to kill it. So almost 500,000 Americans didn't sign up for these exchanges. 500,000 Americans don't have health care today, potentially, because the Trump administration stopped advertising the exchanges and because the President of the United States told people, essentially, not to sign up. Finally, let me talk about what is happening right now with respect to something called cost-sharing reduction payments. A big part of the Affordable Care Act, I mean, really the foundation of the Affordable Care Act, is subsidies that are given to individuals, often passed straight through to insurance companies, in order to help folks that are lower income buy insurance. And guess what? Republicans think this is a good idea, too. I know that because we stole the idea from Republicans. This was initially a Heritage Foundation plan that was adopted by Mitt Romney in Massachusetts. It was the Republican alternative to the Clinton health care bill in 1993. So this idea of individuals getting subsidies, this is a Republican idea that Democrats stole, and Republicans included it in the House bill. The subsidies are just lower, but they're still there. The subsidies come in two forms. One, there is a tax credit to individuals based upon their income, and two, for lower income individuals, there is a payment that goes to the insurance companies that mitigates the amount of money that you have to pay out of pocket. Just two different kinds of subsidies. These subsidies are relied upon by the insurance companies to continue to offer these products. The Trump administration is paying the subsidies, but is trickling them out 1 month at a time, constantly making public pronouncements that question whether they will continue to make those payments. Here's what OMB Director Mick Mulvaney told reporters. He said that the administration could pull the plug on subsidies at any time. He said, we haven't made any decisions. The payments are due, I believe, on the 20th or the 21st of every single month. We have not made any decisions at all on whether we will pay in May. Think about if you're an insurance company executive deciding, A, whether to put a plan on an exchange, or B, if you put a plan on an exchange, how much to charge. And the White House is telling you, you may not get the subsidies that are called for under the law. And we may give you no warning in pulling those subsidies. We're going to pay them for May, might not pay them for June, maybe we'll pay them for July and August, maybe we'll pull them for September. How would you make a decision on how much to charge consumers? Why would you enter into a contract with a state or federal-based exchange? So whether it is the attack on the individual mandate, whether it is the decision to pull advertising, or whether it is the games being played with cost-sharing reduction payments, there is a coordinated effort inside the White House today to destroy the American healthcare system to the extent that much of the system has the Affordable Care Act at its foundation. And President Trump was pretty clear about this the day of the failure of the first health care bill in the House of Representatives. He essentially telegraphed that he was going to try to undermine the Affordable Care Act as punishment to Democrats. And if he hurt enough people, that eventually Democrats would come to the table and negotiate with him. Well, I have a message for the President of the United States. That's not how it's going to work. You are not going to blackmail Democrats by hurting our constituents by undermining the Affordable Care Act. We want to be part of this discussion about improving the health care system. We do. We want to work with Republicans. It'll be a much smaller and likely less revolutionary bill than Republicans are considering today, but it will have both parties' fingerprints on it. We are not going to be part of a bill that strips health care away from tens of millions of Americans, and we cannot support this administration while it seeks to undermine the Affordable Care Act on a daily basis. If these exchanges fail, I don't think they will, but if exchanges fail or if rates go up, there is only one place to put the blame: an administration that is actively, regularly, on a daily basis trying to sabotage the Affordable Care Act. I yield.